Good morning, everyone. Thank you so much for joining the new PSYCKES features webinar today. We'll be going over new features included in release 8.5 and 8.6. So a double release just occurred earlier in April, and we're excited to go over these new features with you. So this webinar is hosted by the Office of Population Health and Evaluation. And let's go right into the agenda. I'm sorry, there's just some housekeeping before we get into the agenda. All phone lines have been muted to help prevent background noise. You can ask your questions today using the Q&A feature in WebEx, and that should be located on the bottom right-hand corner of your screen. And if you type questions using the Q&A feature, just make sure you're submitting to all panelists, which should be the default option. Please do not use the chat function. That shouldn't even be an option for this webinar, but just in case you do see it, we'll only be monitoring questions coming in through the Q&A feature. And then slides and recording will be sent to all attendees after the webinar, and it will also be posted to our public website within the next week or so. Now here's our agenda. We'll be doing a PSYCKES overview, which might be a review for some of you, and then we'll get into the real meat of today's webinar, which is the new features that we've recently added. So some of these new features include Recipient Search redesign. We have the planning considerations column that's been added to Recipient Search results. We have a new Medicaid Recertification filter option and clinical summary notification updates. We have a new advanced view. So this includes data on complex needs, Health Home Plus, and high fidelity wraparound. We have safe options support, SOS team program and contact information that's been added to the clinical summary. And then we have mobile crisis team data, notification information, and crisis services data within the clinical summary as well, and more. So a lot to go over today. And then we'll be doing a quick poll just to see if there's any other new feature suggestions that you have as our users. And then we'll end with Q&A and training and technical support. Now, before I get into the PSYCKES overview, I did want to mention with our latest release, if you do experience loading issues trying to log into PSYCKES, we recommend you clear your browser's history and then try logging in again. So here's just some steps to clear your history in both Chrome and Edge. So to clear your browser's history, you would open the settings menu in the top right-hand corner of your browser, which should look like 3 vertical dots. And then you'd select delete browsing data. And here you want to make sure you select at least deleting data from the past 7 days as the time frame. You could do all time, 30 days, but you just want to make sure it's at least within the past 7 days. And then click delete from this device or clear now. And then we recommend closing out of your browser completely and opening up a brand new browser window. Then you would just navigate back to PSYCKES and attempt to log in again to the application. If you're still experiencing issues, just try logging in again using a different browser or a private or incognito window. And we do have a user guide with some screenshots that we'll make sure to send to everybody after the webinar as well. But if you continue to have issues, even after trying both of these troubleshooting steps, just feel free to email us at PSYCKES Help, and we can help navigate through a way to fix that for you. Okay, so now we'll get into our PSYCKES overview. So what is PSYCKES? PSYCKES is a secure HIPAA-compliant web-based application that integrates multiple data sources like Medicaid and state database information to help support population health, quality improvement, care coordination, and clinical decision-making. And we do have ongoing data updates within the application. We have our quality indicator reports. Those are updated on a monthly basis. And then our client-level clinical summary is updated on a weekly basis. Now, who is in PSYCKES? Who's viewable? Right now, we have over 13 million individuals that are in the PSYCKES application, and this includes folks with any history of Medicaid-funded behavioral health diagnoses or treatment, or folks with state PC, inpatient or outpatient services, or individuals with health home outreach or enrollment. And we do have data across the treatment spectrum, so not just behavioral health information, we also have general medical, residential, lab pathology, dental, vision, transportation, and more. Now, what data do we have available in the application? So we have that client level clinical summary, which provides up to 5 years worth of data. And again, that's updated on a weekly basis. And we have two main buckets of data that are feeding into our application. We have Medicaid fee-for-service claims and managed care encounter data, which is our largest data source feeding into PSYCKES. And this includes information across treatment settings. So you can see data on medications, medical and behavioral health, outpatient and inpatient services, ER, crisis care coordination, etc. One thing to note about the Medicaid data source is that there is a billing lag from the time the service occurred to the time it shows in our application. So something like medications is a little bit more quick and timely from the time the medication is picked up to when it shows in our application. That's might be up to around 2 weeks for when it shows in PSYCKES, but something like outpatient and inpatient services that could take upwards of a few months from the time the service occurred to the time that it shows in our application. So just something to keep in mind with Medicaid billing data that there is that data lag. But this is why we have this other data source, which is state administrative databases. These are considered more real time with a 0 to 7 day lag. So just for a few examples here, we have information on health home enrollment and CMA provider information. That's coming to us from MAP, so that also includes the health home referral contact information. We have state PC center EMR data, AOT, assisted outpatient treatment information, and provider contact data coming from TACT. We have a couple of data pieces coming from CARES. We have assertive community treatment contact information, and then adult housing and residential information as well. We have data coming from NIMERS. And then lastly, we have intensive mobile treatment, AOT referral under investigation, and one of our newer data pieces, mobile crisis team data coming to us from DOH-MH. Now we have quality indicators that are otherwise known as quality flags in the application. So what PSYCKES does is it identifies clients flagged for a quality concern in order to help inform the treating provider and to support that clinical review, care coordination, and quality improvement. Now we have statewide reports and MyQI reports, and these are updated monthly. And what these reports do is they display all quality indicator prevalence rates at different levels. So that includes the statewide level, the region, the county, network, provider, program, and managed care plan levels. Now, right now we have, I think, over 80 or 90 quality flags in our application. So here's just a couple of examples of what those quality indicators could be looking at. So no diabetes monitoring for individuals with diabetes and schizophrenia. We have low medication adherence flags for individuals with schizophrenia. We also have high utilization quality indicators for inpatient and ER services, and then eligible for Health Home Plus quality indicators as well for folks that haven't had a Health Home Plus service in the past 3 months or 12 months. And then the last note here is just discussing our performance tracking indicators. So these are a unique indicator set in PSYCKES because they're run by the Department of Health and they are calculated on mature data to make sure all of the mature data is reflected in the application. So there's a 6 or more month data maturation period for these DOH run measures to allow for all service invoicing to come into the application. So there is a different as of date for these measures in the application. And we just want to note that there's a lag for these. There's a different as of date. And that's shown in the quality indicators section of the application, the difference there. Now we have a few different reports available in PSYCKES. We have our client level clinical summary, and that takes that Medicaid information and state database history up to 5 years worth of data for an individual. And then we have provider level reports. So this includes something like MyQI report, which displays that current prevalence rate and performance on all quality indicators for a provider. And you can even drill into a specific quality flag and review the names of clients who meet criteria for that flag. And then for provider users specifically, you also have the option to enable access with this report. And then we have recipient search. So this is where you can run ad hoc reports to identify any cohorts of interest. We have our advanced views, which I'll go over our new one today. And then you can also enable access. Our usage reports are used to monitor protected health information accessed by staff. And then utilization reports are really meant to support provider-driven value-based payment data needs. And then lastly, our statewide reports I just mentioned. Here you can select a quality indicator and review those statewide proportions by provider location, region and county, client residence, region and county, plan, network, provider, etc. So that's our brief PSYCKES overview. Now we're going to go into our new features that were recently added earlier in April. So our first feature we want to go over today is the Recipient Search redesign feature. So this includes Recipient Search, and it's been separated into two distinct tabs. So right now, when you log in, you'll see an individual search tab and a cohort search tab. And these tabs function independently. Now, the individual search will work just like before, where you can search for a single recipient using one of their specific recipient identifiers like Medicaid ID or Social Security number, or you can search using their full last name and either their date of birth or their first name. We also have client characteristic filters on this page as well to help narrow results, especially if you're searching for someone by name, since there's over 13 million people, you could have more than one result show up. And then the cohort search page is used to identify a group of recipients who meet specified criteria from the filters that you've selected. So this is what the recipient search redesign looks like. Right now, we have gone to recipient search in the purple navigation bar at the top of the screen. We've landed on the individual search tab. So here again is where you can search using a recipient identifier, like a unique identifier such as Medicaid ID or Social Security number. If you don't have that unique identifier, then you have the option to search by, again, last name, full last name, and either date of birth or full last name and first name. To narrow your results down even more, we have characteristics here. So that includes adding on an age range or gender, race, ethnicity, or the client residence region or county. And this data is refreshed on a weekly basis. Now, the cohort search page, I'm sure looks very familiar to everyone here, but this is where you'll do that group cohort search using any combination of filters. So again, we have the option to search for characteristics here. There's a bunch of other options below that, such as our populations and planning considerations column, social determinants of health, managed care plan and Medicaid. We have medication and diagnoses or service settings. So this is where that group cohort search, those filter options live. So when you log in, just keep in mind now that there's two tabs on recipient search. Our next new feature that we have is planning considerations. So a new column called Planning Considerations has been added to the Recipient Search Standard Results view. So this was really added to help users quickly identify flags, notifications, documents, and any other considerations relevant to planning for that individual in service coordination. And you can view this data without client consent or the need to drill further into the clinical summary. So here's the data that the planning considerations column can include when applicable to the client. So the first set of information is based on notifications. So we have complex needs, Health Home Plus eligible, high mental health need, mental health placement consideration, Medicaid recertification due within the next 3 months, and then if that individual is OPWDD services eligible. So those are the notifications that can be included in the planning considerations column. We've also added here documents. So if the recipient has had a safety plan added to their clinical summary, a relapse prevention plan, a psychiatric advance directive, otherwise known as a PAD, a care plan, a discharge plan, or other types of documentation that have been linked to their clinical summary, you will see that certain document title and the most recent date of that document for that client in the planning considerations column. So here's an example of what that looks like. So I logged in, I went to recipient search, I ran a group search here as Main Street Agency. I looked up who's enrolled in my care management agency, and then I ran that search. And here's my results page. So this looks very similar to before. We have the client's name, their Medicaid ID, date of birth, their race and ethnicity, their Medicaid managed care plan, any quality flags that they meet criteria for, and the current PHI access column. Now, the new one's highlighted here, planning considerations. So here you can see a few different examples of what that could look like for different individuals. So this first person has notifications, and you can see that they meet complex needs criteria. They're eligible for Health Home Plus. They meet high mental health need and mental health placement consideration criteria. Now, one thing I want to note here is this person in the second row you don't have access to their clinical summary. No access here. We don't have consent or emergency access, but we can still see data in the planning considerations column. So we can still see that this person has their Medicaid recertification due within the next 3 months. And then below that, just for some other examples, this person has a safety plan that was added back in 2018. And then down here, they have all available notifications that could be included in the planning considerations column. So you can either drill into a clinical summary if you have applicable access to view more information, like view those safety plan details, or add a new safety plan maybe, since this one hasn't been updated since 2018. Or you could drill in to learn, okay, what specific complex needs or Health Home Plus criteria is this person meeting? And then you can also export to PDF or Excel. So that's our planning considerations column. The next new feature is Medicaid recertification, NISO, and LDSS. So based on new federal regulations for Medicaid coverage, we are capturing individuals needing to recertify their Medicaid coverage via the New York State of Health, NISO, or their local Department of Social Services, which is LDSS. So in Recipient Search, within the Managed Care Plan and Medicaid section, within the Medicaid enrollment status filter dropdown, we've added 3 filters here related to Medicaid recertification, and it's based on where the recipient needs to renew. So what this looks like now is Medicaid recertification due within 3 months, and this includes both NISO and LDSS renewals. Then we broke it out into 2 separate categories: Medicaid recertification due within 3 months, and this group of people would have to renew via NISO, and then the second group of people would have to renew specifically via LDSS. So there's a way to search for anyone that needs to renew, and then renewal based on NISO and renewal based on LDSS. And then in the clinical summary notification section, we've added a new LDSS notification, which will display when applicable to the client. And we've updated our current NISO message. Both of these notification messages include contact information and recertification links to help with that recertification process. And these messages are refreshed on a weekly basis along with these filters. So what does that look like? So we've gone to Recipient Search, and we've scrolled down to the Managed Care Plan and Medicaid section. And here's the Medicaid enrollment status filter, and we've opened that up and highlighted down below. We can see our 3 Medicaid recertification filters. So this top one, Medicaid recertification due within 3 months, that includes both NISO and LDSS renewals. And then again below, we've divvied it up into who needs to renew via NISO and who needs to renew via LDSS. So if you run an example search here, so in this example, we've looked up who needs to recertify via LDSS. I'm logged in as Main Street Agency, and here's my results. I can see over 1,100 people need to recertify via LDSS within the next 3 months. And if I just look at this planning considerations column, this is another area I can see who needs to recertify within the next 3 months as well. So even if I ran a different search here without this filter on, I will still see who needs to recertify if they meet that criteria in the planning considerations column. Now I've drilled into a clinical summary here. There's just a few things I want to point out. So we're on the brief overview screen, but this also applies to the full summary view. So at the top, I can see when this individual's Medicaid eligibility will expire on, if that date is available. So this person needed to recertify within the next 3 months, and I can see, okay, at the end of May, their Medicaid eligibility will expire. And then if I go down to the notification section, I can see highlighted here the new LDSS Medicaid Recertification message. So this shows me Medicaid eligibility alert. This client needs to recertify their Medicaid enrollment through their county local Department of Social Services, and then it provides the expiration date for that individual. And then there's more information for how to renew via the LDSS process, and then you can also contact the client's county LDSS, or if the client needs help with that process, there's a facilitated enroller link as well. Now here's what the NISO recertification message looks like, very similar, but this just says the client must recertify their Medicaid enrollment through the New York State of Health enrollment system. So there's a phone number for NISO or a website link for how to renew your health insurance via NISO. And then there's also an enrollment assister if the client needs help with that process. So that's the Medicaid recertification updates. There will be more to come in our next release, but this is what we have live currently in the application. The next new feature is the Complex Needs Health Home Plus High Fidelity Wraparound Advanced View. And this is a new advanced view that's located within the Recipient Search results page. So when you apply this advanced view to your results, it will add on additional columns. So one new column will be added on for complex needs, another column for Health Home Plus eligibility, and then a third column for high fidelity wraparound likely eligible. So these three columns specifically will display yes if the client meets any criteria for any of those categories. And that yes will be displayed even if you do not have consent or emergency access. Now, additional columns beyond those first three will be displayed to show you the specific criteria for each of these buckets. So we've divvied them up into a risk category, high ER inpatient utilization, or youth with residential treatment. We have an intensive outpatient category, and then crisis services among youth. So these categories will display the individual criterion that the recipient meets. So there will show a yes in that specific criteria column if you have consent or emergency access for that individual. So I will show you what that looks like. So we are on recipient search results again. This is the standard results view, and at the top right-hand corner, we have a view drop-down. So here you can see our view, advanced view options, and if I click on that little eye icon, I can actually see a pop-up to view which columns will be displayed or added on to my standard results view. So we have care coordination, our new complex needs, high health and plus high fidelity wraparound, high need, high risk, hospital utilization, and outpatient providers. So for complex needs, Health and Plus and high fidelity wraparound, it just lists those specific categories that will be added on to your standard results view. So you can see now I've added on that complex needs Health and Plus high fidelity wraparound advanced view, and now my results page looks a little bit different. So here I have my basic standard results view columns, and then you can see these highlighted columns here are new. So we have complex needs, Health and Plus eligibility, and high fidelity wraparound. Now these three columns again, the data is available in these even without consent. So you can see in this third row, I don't have access or consent or emergency access to this person's clinical summary. However, I can still see yes, they meet complex needs. Yes, they're eligible for Health Home Plus. Now on the bottom left-hand side, you can click that scroll bar and scroll over. And this is where you'll see those individual criterion for each of those three categories. So again, this is the risk bucket. And here you can see if somebody has had AOT active or expired in the past year, if they've had a CNYPC release in the past 12 months, homicidal ideation, suicide attempt, opioid overdose, if they've had homelessness in the past 6 months with a DOH SMI in the past year, or if they had K3 emotional disturbance in the past year as well. And you'll notice for certain categories, it'll say youth only in parentheses. So that just is a reminder that that category is specifically just for youth. So if we scroll to the right, now we can see we're going into our high ER inpatient utilization or youth with residential treatment category. So here we have foster care in the past year for youth, 3 or more inpatient mental health visits within the past 13 months. We have state PC discharge within the past 12 months, 3 or more inpatient medical and schizophrenia or bipolar diagnosis within the past 13 months, 4 or more ER mental health visits within the past 13 months if someone's ineffectively engaged, and then if they've had 1 or more inpatient mental health visits within the past 13 months for youth only. Now we can keep scrolling because these columns include all of the complex needs, all of the Health Home Plus, and all of the high fidelity wraparound criteria, all in one advanced view. So there's quite a few columns that were added here. The next bucket is residential treatment facility in the past year for youth, children's community residence in the past year for youth, residential SUD treatment in the past year for youth. Just keep in mind for things like substance use disorder or opioid related criteria, that would require signed consent or emergency access to view. Right now, there is the capability to enable verbal consent, which does not include that specially protected data. So if somebody had verbal consent, you wouldn't be able to view data for things like substance use or opioid use information. All right, the next column is act enrolled or discharged in the past year, Health Home Plus service in the past year with a mental health diagnosis, and then IMT in past year with mental health diagnosis. So if I keep scrolling, then we get to the end of this advanced view, and now we're in the intensive outpatient category, and then we can see crisis services among youth as well. So we have mobile integration team in the past year for youth, day treatment for youth, partial hospitalization for youth, and then 2 or more crisis services in the past year, specifically among youth again, and then home-based crisis intervention in the past year for youth. Now, this is a lot of data that you have access to if you have consent or emergency access for these individuals. So one thing you can do if you want to manipulate this report for what specific criteria you'd like to view, you can export it to Excel on the top right and hide columns, filter columns as needed. All right, well, we're going to go into Safe Options Support SOS Team Data. So SOS teams deliver intensive outreach and care coordination services to high-need individuals within New York State. So we've added SOS team program and contact information into the clinical summary current care coordination section for clients who have received that SOS service in the past year. Now there's rest of state SOS teams and the New York City SOS teams. So for those New York City SOS teams, the New York City SOS 24-hour line will be included in that current care coordination message. SOS team information also shows within the integrated view of services over time graph to help view any of those service utilization patterns. And then within the historical care coordination view. So if they've had an SOS team service beyond the past year, you can find that data within the historical care coordination section. And it's updated on a weekly basis, the SOS data. So this is what SOS looks like in the clinical summary. So same thing for the brief and full summary. It will look just exactly the same. We have safe options support SOS in the current care section. It'll show you the SOS team name, the enrollment date. If they've been discharged, it'll show you the discharge date and the discharge reason if that data is available. And then we have main contact email for that specific SOS team, and then an informational SOS website link as well. So this is what it'll look like for rest of state SOS teams. Looks very similar for New York City SOS teams, except I want to highlight here that we have that additional New York City SOS 24-hour line that was added just for those New York City SOS teams specifically. Now, if you drill into the full summary view and go to the integrated view of services over time graph, you can see here, Safe Option Support, SOS. This person started SOS services at Liberty Resources on 9/20/2024. And you can see if they're still involved, it'll be a straight line even through today's date. If they've been discharged prior to today's date, you'll see an end dot here and then their discharge date along with the provider as well. And then our historical care coordination section, here's what the SOS information would look like. You'd see SOS under the service type, the SOS team name under provider, the first date billed, the last date billed, and then the number of bills as well, or number of services. All right, then we have mobile crisis team data, MCT data. And this was added to PSYCKES from the New York City Department of Health and Mental Hygiene, DOH-MH MAVEN database. So MCT data was added to the clinical summary within the notifications and the crisis services section. So for the notifications, this will display folks who've had mobile crisis team MCT data, who've had an open or closed adult and child MCT case in the past year. So notifications would be MCT data within the past year. Then within the past 5 years, if they've had an MCT service, that would be displayed in the crisis services section and within the IVOS graph. And this data is updated on a weekly basis. So I wanted to show what data elements would be included for MCT data within the notification section versus the crisis services section. So on the left-hand side, we have for the brief and full summary, the notification section. That would include the mobile crisis team name, the referral date, the referral source, presenting problems, provisional diagnosis, case status, transport information, and reason case was not open. And these elements depend on if the data is available or not. So something like reason case was not open might not display for certain individuals if that data wasn't included. Two asterisks are included here because these two data elements are only viewable with signed consent or emergency access. So that's just something to keep in mind. If you have verbal consent, for example, you wouldn't see these two data elements included in the notification section. And then in the full summary crisis services section, we can see the service type, which would be MCT, DOH-MH, the provider, so the mobile crisis team provider name, the admission or date of service, the discharge or date of service, the number of visits or length of stay, the most recent primary diagnosis, again, that's only available with signed consent or ER access, and then the most recent procedures. So what does this look like? We are in the clinical summary within the brief overview right now. And in the notification section, you can see highlighted mobile crisis DOH-MH. So we see the mobile crisis outreach team name here for this individual. We can see when they were referred and their referral source. So this was an internal referral from the outpatient department. We can see, since we have signed consent or emergency access, that this individual has a presenting problem of disorganization and a provisional diagnosis of schizophrenia or schizoaffective disorder. The case opened, yes. So you can see if the case was open, you can see the current status. Now the case is closed. And then we can see transport details. So this person was transported voluntarily, and you can see the destination was CPEP, and then the outcome was that they were admitted to the psychiatric unit at Jamaica Hospital Medical Center. So a few different details are available within the notification section. And if you scroll down on the brief overview, you can see within the all hospital and crisis utilization section, the new mobile crisis DOH-MH data. So this person has one crisis service, or mobile crisis service, and you can see the last crisis service date and the last crisis service provider as well. Now, if we go into the full summary view, we can see this is just a different example here, but same data is included for mobile crisis within the notification section. So this person, you can see the MCT team name, the referral date, and this source was 988. You can see presenting problems, provisional diagnosis, case open and status, and transportation details. Then if you scroll down within the integrated view of services over time graph, you can see mobile crisis DOH-MH will display here if applicable to the client. And if you hover over the dot, you can see the provider name along with that date of service. And then the last section MCT data appears would be in the full summary in the crisis services section. So here we can see mobile crisis, DOH/MH, the provider name. You can see when that date of service occurred, the admission and discharge, the number of visits or length of stay, most recent primary diagnosis. So again, this would be blank if we only had verbal consent, but in this case, we have signed consent or emergency access, so we can see their most recent primary diagnosis. And then the most recent procedures column actually includes the contact type and the transportation details. All right, we have plans and documents filter in recipient search. So we have added a new filter in the populations and planning considerations section within the recipient search cohort search tab. So the plans and documents filter will display a list of recipients that meet criteria on the results page. However, it's important to keep in mind that as a provider agency user, in order to view those specific plans and document details within the clinical summary, you would need a consent or clinical emergency level of access. So if someone has a safety plan, and you can see that on the results page, if you want to drill in and view those safety plan details, you need signed consent or ER access. So here's the different options that the plans and documents filter will display. The top option will be any planner document to look up individuals that have had any of these listed plans or documents attached to their clinical summary, or you can view or search a group of people that have had a specific type of planner document added, like safety plan, relapse prevention plan, a psychiatric advance directive, a care plan, a discharge plan, and there's an other category in the clinical summary. If other is selected and another type of documentation is added to their clinical summary, this category would show who's had other types of documentation added. So in recipient search, we are in the group cohort search tab, and you can see populations and planning considerations. That's the section this new filter lives in. So we have plans and documents here. And again, these are the filter options that I've just gone over. So any planner document at the top or a specific type of planner document below. Now I ran an example search here for individuals that are linked to Main Street Agency that have had any planner document attached to their clinical summary. So I can see over 500 recipients have some type of planner document in their clinical summary. And here's in the planning considerations column, even without consent, I can see what types of plans or documents are added to their clinical information. So this first person has had a PAD added back in 2024 and a more recent safety plan added just last month in 2026. Now, this person I don't have access to, but I can still see that they've had a safety plan added back in December of 2025. And then below that, this person had a relapse prevention plan added back in 2023. So for those older documents, this might be an example of when I'd want to drill into the clinical summary if I have access and work on updating those documents that were added further back in the past. All right, the next new feature is Care Coordination Organization CCO contact information. So Care Coordination Organization CCO contact information has been added to the clinical summary current care coordination section for any clients that have received CCO services in the past year. So this new message will show the CCO name, the main CCO contact line, and the CCO website. So let me show a quick example of what that would look like. So we are in the brief overview, but you'll still see these same details in the full summary. So in the clinical summary current care coordination section, we have care coordination organization, and then you have the CCO name, the main CCO contact phone number, and then that CCO's website as well. So those are some new details for CCOs that were recently added. The next new feature is expansion of CCBHC procedure codes. So for certified community behavioral health clinics, CCBHCs, we've expanded the procedure codes for these service settings in the clinical summary to show beyond the first procedure. So that allows you to view more detailed information on those CCBHC services that were received by a client. So this is within the full summary behavioral health services sections. We will show all CCBHC procedures that have occurred within the past 3 months. So again, beyond that first procedure. And then in addition, you have a drill-in option, and that will show a complete record of all of the CCBHC services and the procedures that went along with each service for that client. So we are in the behavioral health services section. Again, this is within the full summary view. And here you can see this individual had a CCBHC service by Behavioral Health Services North. And you can see the first date billed for that CCBHC service. It looks like they've had around 15. And you can see the most recent date billed. You can see the most recent primary diagnosis. And then here's where that list of procedures is. Again, within the last 3 months, you can see all available procedures that were included on those services. Now, if we drill into that little see details icon, you can see specifically each date of service for that CCBHC service type. And if you come over here to procedures, you can see exactly which procedures were included on that specific service date. So some of these have one specific service, some have more than one. This is where you can see those broken out details. All right, we've also added new care service settings to PSYCKES. So two new care service settings have been added to Recipient Search and the client level clinical summary. So we have housing, community residents, children and youth, and then housing, community residents for eating disorder integrated treatment program. And again, both of these are coming from the CARES database. So to find these and search for them, you can go to Recipient Search and go to the services specific provider section if your provider offers these services, or you can search for these service settings within services by any provider to see who at your agency that you're serving has received these services from any provider within New York State. And these services live within the living support and residential category. And then you can also see them within the clinical summary. So if they've had one of these service types within the past year, you can see that service within the current care coordination section. You can see a history of service patterns for these new service settings within the integrated view of services over time graph. And then you can see historical information on these two new service settings within the living support and residential treatment section. So I will show what that looks like. So here we're in recipient search and we've gone down to services by any provider. And in the service setting box, we've scrolled down to living support and residential and selected this little minus sign here, which opened up that category. And now we can see these two new care service settings here, community residents, children and youth, and community residents for eating disorder. Now, in the clinical summary, we've drilled into an individual who has had one of these services within the past year, and you can see we're on the brief overview screen. So in the current care coordination section, you can see housing residential program, and this is where you can see that new care service setting. So this person had community residents, children and youth at Linden House Community Residence, and you can see their admission date was back in September and their discharge date was pretty recent, so March 21st, 2026, and you can see who the contact information is for that program. And now in the IVOS graph, you can see when that service occurred, just in a graph view. You can also switch to a table view if you'd prefer. But you can hover over the dots for these new service settings if the client has had them within the past 5 years and see the provider name and the date of service. And then lastly, in the living support and residential treatment section, this is where those new service settings would appear. So this person had community residents, children and youth. You can see they had it from Institute for Community Living, and then their first date of service and their last date billed, and then the number of visits for that service. You can also drill into details to see more information like primary diagnosis. Next is recipient search look back period updates. So we have updated the look back periods in recipient search within the services specific provider, services by any provider, and medication and diagnoses sections in recipient search cohort search page. So each of those listed sections up here have this little drop down in the right hand corner where you can specify your look back period for your search. So it defaults to the past year. But we've cleaned up the look back periods and removed some of the more outdated options and then added in January 2023 to December 2023 and then 2024 information as well. All right, the last new feature I would like to show today is the PSYCKES mobile app, which is now available on Android. So previously it was only available on iOS devices. So with this recent release, you can now access the mobile app on Android. And you can go to the Google Play Store and just search for PSYCKES. This is the mobile app icon, a white P within a purple background. And the app is free. So this app really allows people to search for clients from the field, access a clinical summary with consent or emergency access, and we do have an e-sign consent feature within our mobile apps, which is very handy if you're out in the field and you're working with a client and you would like to offer to get their consent and they agree, you have an e-sign consent feature where they can sign the PSYCKES consent form right on your device. And then you can also complete a safety plan or a screening or assessment within our mobile app. Now, for the PSYCKES Android mobile app, there are just a couple of technical requirements. You need to have an Android version 7.0 or higher. And then also, just for both Android and iOS, it's always good to check in the App Store if there is a PSYCKES app update available. So you just search for the PSYCKES app in your App Store, and if there's an update option, then you can update to the latest version. So this is what our Android mobile app looks like. It looks identical to the iOS mobile app, but here's just an example of the search screen, which is what you would land on after logging into our mobile app, where you can search for an individual client using their Medicaid ID, social security number, or name and date of birth. And then if you run a search, you can see on the results page if that client is matching exactly who you're searching for. If they are a match, then you have the option within the mobile app to enable PHI access. So once you tap enable PHI access, these are the options you'll have. So very similar to the web below, you have signed consent options, you have other reasons for access like verbal consent or clinical emergency, or you can attest to serving the client. But mobile app specific, we have this e-sign PSYCKES consent feature here, which will take you through a flow of showing the consent form to the client, having them choose if they agree or deny signing the consent form. If they agree, then they can just sign with their finger on your device and then enable access that way. And you can drill right into the clinical summary. Now, the full summary is available in both mobile apps, both iOS and Android. So this is just an example of what the clinical summary looks like. You can view all available data for a client's treatment history, just like what you see on the web. And it includes all available positions of diagnoses. You can see procedure information and practitioner information as well when you drill into services. And then you can complete a safety plan in the mobile app. So here we've gone down to the plans and documents section of the PSYCKES mobile app. You can see any previously entered plans or documents, and then you can tap complete a safety plan, and that will bring up the Stanley Brown safety plan template, which you see on the right-hand side. And this is where you can start filling out the safety plan template fields. You could even save a draft if you want to come back to it later on. But once it's done, you can add it to the clinical summary and it'll appear right in the plans and documents section. And then our screenings and assessments section. So this is where you can complete a PHQ-9 or CSSRS. So if you tap on that hyperlink, you have the option to choose the depression or suicide screening, and you can follow those questions there and then submit that and add that to the individual's clinical summary. And that sums up our new features. We ended on the Android mobile app. So now that we have gone through all of our new features, we did want to get some more feedback from you, our users, to see what other new features you'd like to see in the application. So we do have a Slido poll we are hoping to run right now. And you should see Slido in the bottom right-hand corner of your screen, of your WebEx screen. And I've just launched our first question. Let me bring that up here, which is, would you like to see any other enhancements added to recipient search? And I don't even want to just make this just about recipient search. Any other enhancements or examples of things you'd like to see added to the application in general? We always want to get as much feedback as possible from our users to see what would be helpful for the work you do. So just some examples here, and this is for recipient search specifically, but not limited to, new filters. Are there any new population filters you'd like to see added? Demographic or social needs options. Are there new service settings you'd like to see, like CTI, add SOS as a service setting, mobile crisis team as a service setting, enhanced step down? So anything you would like to see added to PSYCKES in general, we welcome all of your feedback right now with our first poll question. So it looks like we have some responses coming in. Some folks are saying nothing right now is needed at this time, which is great to hear that, PSYCKES is suiting your needs for the work that you're doing. Some other suggestions for CTI as a service setting, SDOH needs, MAS transportation, tabs, ID. This is very helpful. Reflect a member receiving health home services and then stepping down to a less intensive service. That's a great suggestion. Okay, I understand people might need to, go in, play around with these new features and the application in general, and then things might come to them for new features that they'd like to see. So I do have a slide on how to submit your suggestions after the webinar is over. So don't feel like this is the only time you'll be able to voice your opinion here. So I'm going to stop this poll and I'm going to start another question. And let me pull that up on the slide so you have a second to think it through. And then I can launch this poll. Are there any additional data sources that you'd like to see added to PSYCKES? And I've just launched the poll here. Just some examples, we thought of were cost-related data, O2DA data, any other data sources that you work with that would be helpful to see or utilize or be pulled into the application. So that poll is now live. I'm seeing O2DA, awards, enrolling in the MAP program. This is wonderful feedback so far. Another vote for O2DA awards, OPWDD, eClinical Works cost-related data. This is very helpful. Oh, a housing referral, interesting. School district enrollment for youth, that's a great suggestion as well. Thank you all for your feedback. This is very helpful. And we'll be saving all of your answers after the webinar, and we'll bring that back for further review. Thank you for answering the second poll question. We just have one more, so let me deactivate the current poll. I'm going to go to the next question. And then I will launch this final polling question. Would you like to see any functionality updates within the application? So something like multi-select capabilities. Right now we have that option within a few different filters like complex needs. You can select up to 4 different complex needs criteria, uh, all within one filter box. You can select multiple homelessness filters for your search. Creates an or logic. So if you select, homeless in the past year, and then let's say shelter in the past year specifically, that would look for people who are homeless or shelter homeless in the past year. So more multi-select capabilities, that seems to be resonating with people based on your feedback. And then additional look back periods or any other functionality updates that you would find helpful in the application. Great, great, getting good feedback here. Thank you everyone for your answers. This is extremely helpful for us to help inform, the work that we do and how to best help you all do the work that you do. All right, I think it's slowing down a little bit, so I'm going to leave this poll open since it's our last question and move on to our next slide, which is how to submit feedback after the webinar. So things might come to you when you're using PSYCKES or thinking through your use case after our webinar is over. And what you can do is email PSYCKES help and include a description of the feature you'd like to be added, and we just request that you're as detailed as possible, the purpose that the new feature would serve, and how it could help a larger group of users since we have over I think 20,000 users at this point. We'd love to hear how your new feature suggestion could help a larger group of our users. So these are the steps that you can take. If you think of anything else after the webinar, you can always reach out to PSYCKES Help. And I'm just going to end on training and technical support now. So we have a few different resources available on our public website, psyches.org. We have webinars, which you're on right now. We have live webinars offered quarterly, and then also recorded webinars and slides, which are divided into role-based trainings, feature trainings like today, access, and then release overview as well. So a few different training webinars available on our webinars page. We have user guides as well, which go over each area of our PSYCKES application, and then short how-to videos for things like self-service console information for how to manage your token or how to review a client's clinical summary. And then I will end on technical support, and then we'll go into Q&A. So if you have any questions regarding our PSYCKES application, you can always reach out to our help desk at psyches-help@omh.ny.gov. We are available 9 to 5 Monday through Friday, and we really pride ourselves on responding to users within one business day. So even if you have a more complex question and we can't answer it right away, we'll at least let you know that we've received your email and we're looking into it. So any PSYCKES questions can come to our help desk. But if you're having issues with your token or logging in, like getting an authentication error, you can contact the ITS help desk if you're an OMH or state PC employee. And then if you're a non-OMH, non-state PC employee, we have the OMH help desk email and phone number on the screen as well. So with that, I am going to turn it over to Ashma to see if there were any questions that came in.
Hi, Michelle. We do have a few questions coming in. So the first one is, would New York City HRA be included for Medicaid recertification renewal needs?
That's a great question, Ashman. I think we should take that one back. I'm not positive, and I don't want to give the wrong answer.
Gotcha. Thank you. And then the next one is also regarding the Medicaid recertification. And the question was, do members need to be renewed annually? Can they renew through a health plan? Or do they have to go through LDSS or NISO?
That's another good question. I feel like the renewal timeframe might be changing just with new regulations. So why don't we take that one back and then we can touch base with our Medicaid colleagues just to best answer that question.
Absolutely. Thank you, Michelle. And another question was regarding the mental health placement consideration. So the question was the mental health placement consideration moved from the quality flag section of the full summary to the notification section? And is mental health placement consideration a quality flag itself or just an indicator set?
That's a great question. So, mental health placement consideration now lives within the recipient search population health dropdown. So, it has been removed as a quality flag and will display instead in the notification section. And then, if you want to run a search on individuals who are considered uh, in the bucket of mental health placement consideration, that's within the recipient search cohort page within the population dropdown. So those are two ways you can access the placement consideration filter.
Gotcha. Thank you, Michelle. And we have another question also regarding the Medicaid recertification. And this was, is there a separate flag to show if the Medicaid has lapsed or was not recertified in time?
That's a great question. So we do right now in the Medicaid enrollment status filter dropdown have an inactive Medicaid option, meaning it's inactive and expired. However, we are looking in our next release to make this more user friendly for folks that have had inactive Medicaid within, let's say, the past month or the past year. So you can, look at who's more recently been inactive versus who's been inactive for a while. So that option is available within the Medicaid enrollment status filter in the recipient search group cohort search page. Inactive Medicaid would be the filter I would suggest using for to see people who've already expired.
Thank you, Michelle. And then this was a question regarding Psyche's consent, and we have answered it in our Q&A box, but I thought it would be good to discuss it on air as well. So it was regarding the consent process, and they thought that there was only one Psyche's consent form, and that would give provider consent for anything on Psyche's database. Um, so I think it would be good to discuss some of our consent options that are available in Psyche's.
Sure, that's a great question. So we have the Psyche's consent form, and if that's signed, that would give access to everyone at your agency, access to that person's full clinical summary, including the data with special protections. We have a BHCC consent form, so that is if that's signed by a client and attested to by a provider agency in Psyche's, that's part of a network. That means then the network would also get access to view that client's clinical summary. And then the DOH health home consent, if that is signed and attested to in the application, that means the health home and care management users at your agency would get full access to that person's clinical summary. So those are the signed consent options. The other ways to enable access would be clinical emergency, and then that's available, all available data for 72 hours. Verbal consent, that's a little bit different because that allows you to access the client's clinical summary, but does not include specially protected data. And that means you won't be able to see substance use information, HIV, genetic testing, and family planning data. So that's just a little bit of a different consent level compared to the signed consent options. And then I think the last one was attestation of service, and that would link a client to your recipient search reports, but it would not allow you to access their clinical summary.
Thank you, Michelle, for going over it in detail. And we do have a few other questions coming in. And the one that we have here is how can we see what agencies are active Medicaid?
How can we see what agencies are active Medicaid? There's a filter we have for active Medicaid for recipients that you're serving at your agency. Um, I'm not sure if I'm fully understanding that question about what agencies are active Medicaid, so we might need to get more details on that one.
Thank you, Michelle. And there was another question where it says, is there a plan to incorporate any other New York State mobile crisis teams into Psyches?
So right now we just have mobile crisis data coming from the DOHMH Maven database, but I will take that back as a suggestion and see, what other ways to incorporate more mobile crisis team information into Psyche. So that would be a good one to take back and think through as a future enhancement.
Absolutely. And then the last question that we have here, and we may also need additional date information, is do all MCRT need to be entered in psyches? And I wasn't sure what the MCRT was referring to, but I wanted to ask if you had any additions for those.
Yeah, I think I also need more details on what MCRT means. Unfortunately, I'm not familiar with that, so that would be another good one that we could follow up on for more details.
Absolutely. And we do have our help desk information here. So if you have any questions, we can also do a follow up through there as well. But those were all the questions that we have at the moment. Thank you so much.
Yeah, thank you, Ashma, and thank you everyone for writing in your questions and for coming to today's training. Again, these slides and recording will be sent to everyone and posted to our website very shortly. So I just appreciate everyone's time. I hope you all have a wonderful rest of your day and take care.